Moving on to our next speaker, he is ROSHAN Kumar Singh, a founder of Wellness by Rosh, to create ripple effects of health and wellness around the world. A certified integrative nutrition health coach from the Institute of Integrative Nutrition, New York, USA, and certified by IAHC, International Health Coach Association, having specialization in plant-based diets, gut microbiome, hormone health, emotional eating, and psychology. Functional medicine, functional blood chemistry analyst, and Hatha yoga teacher. Wellness by Roche focused on the approach of integrative nutrition and lifestyle based on functional medicine, clinical nutrition backed by science and research, and guide and empower its clients to live the best of life with optimal health and wellness and to experience real joy. He believes functional medicine approach for chronic kidney conditions and dialysis can help to reduce toxin overload, improve quality of life, and reduce challenging symptoms and extend life and health. His topic for today is role of functional medicine in kidney health. Over to you, sir. Please go ahead and share your screen.
Thank you, Karishma, for the beautiful introduction. Hello, everyone. I'll just share my screen. So...
My screen is visible. Please maximize it.
Yeah.
Yeah, we can see it and you're loud and clear as well. Please go ahead.
Okay. Hello, everyone again. Good evening and good morning, whoever joining from abroad. So today I'll be talking about how functional medicine can help in chronic kidney disease and any kind of kidney disease, whether it is IgA related, whether it is a acute kidney disease. So we'll be discussing about what are the solutions. So it will be more solution oriented session. Yeah, so go to the next slide. Yeah, so I'll be giving only little introduction about, what is the importance of kidney and what are the symptoms we get for chronic kidney cases, and what are the root cause approach, how we do the blood markers, and what are the holistic and functional medicine approach towards either restoring the kidney functions or maintenance of the kidney disease. And what are the key supplements which can be really helpful in managing symptoms and improve the quality of life. So as you know that we are lucky to have two kidney and they take care of, like, they both helps in a lot of functions, like some of the functions which are they help to remove all the urea and the waste product, like the uric acid, and there are so many other waste products. They help to balance the electrolytes, like sodium, potassium, calcium, all the electrolytes. They help in balancing. They are really the kidney actually produce some hormones like prostaglandin and really helps to maintain the blood pressure. They actually produce a hormone called calcitriol, which helps in the activation of vitamin D3. They are like other whatever the drugs someone is taking or medications, all the byproduct of that, the waste of the drugs are also being excreted by the kidney. Kidney helps in the red blood cell production. So anyone having kidney disease, we find they are all anemic and low hemoglobin because the hormone erythropoietin, which is actually made by kidney. So if kidney function is not normal, then there will be deficiency of that hormone, and that lead to anemia. Any water excretions, distributions, like how much urine has to be output, it's all controlled and managed by kidney. And any excess content, anything which the liver has detoxify, and whatever the waste product which has to come through the bile. So some goes through the gut pathways, and most of the other thing has to be filtered by the kidney. So as you see that kidney symptoms doesn't come, because we have one pair of kidney, like two kidneys. So we don't see kidney symptoms even if someone is suffering from kidney disease. Like we see sometimes young cases and they have lost one kidney and then they come to us. So we see sometimes like until someone is doing a blood test and monitoring the GFR or creatinine level. So these are some of the symptoms which comes in the later stage, and those kind of patients already have either diabetes or some kind of autoimmune disease or a cardiovascular disease. So we see that their urine output is decreased. It can also happen in the kidney stone case. A lot of anemia. We see the water retention in the lower part of the legs. Sometimes it's like unable to breathe properly whenever they are trying to sleep. Fatigue is one of the classic symptom, but it can be also related to other disease like anemia and thyroid and other things. They start getting nausea after every meals. That's like one of the primary symptom we see. Sometimes they can complain of chest pain and the heartbeat can go high. So these are the symptoms, but sometimes the symptoms comes very late and already kidney disease already had kicked in. So yeah, so these are a little bit of detail on the blood markers we usually one should do if someone having any doubt on whether the kidney is working well. You know, albumin is one of the important marker, but primary we check creatinine level and uric acid and albumin. Sometimes we check the BUN and bicarbonate. These are this talks about, you know, what is the urea load and what kidney is able to remove and what is still staying in the blood. So BUN and urea and albumin and the creatinine, these are sufficient. But yeah, someone having an abnormal creatinine level, then we go a little bit deeper and we do more tests, like we check albumin, we check homocysteine, which is the most important. We already had a session with Dr. Anish today. So homocysteine is one of the important marker for, you know, cardiovascular and other metabolic issues. Liver panel, iron, a lot of nutrient deficiencies can happen in kidney disease, and heavy metal is also associated. We see a lot of cadmium, lead, arsenic in kidney chronic kidney cases. Uric acid test we actually do to rule out the gut pathways, like whether there is any like dysbiosis. So we wanted to check, and also mitochondria function. So these two things are really, really important to overall review the kidney disease. This is a classic. I mean the table which talks about, you know, if someone having a creatinine high, so which is actually indirectly used to calculate the GFR, which is a glomerular filtration rate. So kidney has, as you know, kidney has a lot of capillaries, and it also has a blood supply. It does a lot of filtration process. So glomerular is the unit, and there's a nephron, which is the smallest unit, so which takes care of the filtration. So anyone having creatinine level going up above 1.3.
फ्री बैठ के थक गई हूँ.
So can everyone can mute?
Okay.
Requesting everyone to mute yourself, please. Okay, so coming back to this.
एक और पेशेंट ने भी रेफरेंस दिया कि मैं यूएस वाले को शेवल करके, जो पेशेंट है ना हमारी, कि मेरा एक फ्रेंड है यूके में.
Excuse me, ma'am, can you mute yourself? Okay, thank you. So coming back to this table, so someone having GFR above 80 or 90, or like usually the optimal range is above 100, 110. But the moment we see the GFR going down with the increase in creatinine level, then if there are someone already having this symptom, like this blood markers, then if they start early on the kidney repair and restoration, then there are high chances that they can either restore fully or they may not have any need of dialysis. If someone comes at the creatinine level, say 20 or 25, then we need a more proactive approach to actually extend their life and also like to prevent dialysis. So usually someone who comes with creatinine 15 and 16, we can extend dialysis for 2 years to 2.5 years. But ultimately they will be needed dialysis in future. And we sometimes, we are able to also improve quality of life and decrease the frequency of dialysis once they are, even if they are on dialysis in future. And the albumin, what is there on the top right side, that albumin leakage can also happen in the urine. So it can related to, sometimes we see in IgA nephropathy or glomerular nephritis, we see a lot of albumin leakage. So that can also classify the low kidney functions. So these are the, if you see the worldwide record or even Indian population, the diabetes is like also one of the highest marker for the IgA nephropathy on the chronic kidney disease. Second come the hypertension, and right now we are also seeing a huge jump after COVID is the autoimmunity. So a lot of patients who are having arthritis or they are on the steroid for such a long time, people who have been doing angiogram or CT scan, they all are, going towards the kidney, low kidney functions, and creatinine, as well, we see a jump in the creatinine level. This is one of the nice example about the gut, like how, so when the kidney function is decreased, we have to think about what are the other organ we can utilize to detoxify the toxins. One of the most other organ is the gut pathways, and then you have skin. So skin, using skin as a detoxifying pathways can be a challenge in kidney cases because they are already limited on the hydration and the water intake. But gut pathways really play a big role. So if you see this diagram, the healthy gut, they are all like, there's no, the mucus layer is quite strong. There is no like a passage where the toxins and bacteria can go into the bloodstream. And then if someone having a microbial dysbiosis, like imbalance of good and bad bacteria, which can deplete the mucosal layer, and this bacteria can enter into the bloodstream, which can cause that uremic toxins to be circulated into the blood, which can increase the load on the kidney. So it can increase the filtration rate, so GFR can go down, and other endocrine functions. So we are trying to use in the functional medicine, we're trying to use the gut pathways so that we can decrease this uremic loads. So we are using some kind of probiotics which can actually eat this urea and stuff, and they can multiply, and they are reducing this inflammation from which is causing the kidney to further lose its functions. So this is what is being, I'll be discussing more in detail about this thing. So this is what the gut pathways as an organ we wanted to maximize the utilization. Overall, as a functional medicine, this is what we usually try to optimize in a kidney patient. Like most of the kidney patients, they have lack of sleep, they're insomnia, they are depressed because of emotional and other issues. Their nutrients levels are quite low because most of the nutrients, their diet is pretty much, like restricted diet, and they cannot have the variety of stuff. And because of the phosphorus, calcium, and potassium low intake and sodium low intake, they cannot have enough of nutrition. So we have to have a focused and custom nutrition program for them. Microbiome, I'll be talking a little bit more detail. So what bacteria can help in what kind of problem that person has. Some kind of exercise and movement is crucial to move the toxins away from the cells. The mind-body approach, like we do sometimes some sound healing, and sometimes yoga nidra and all we use in kidney cases to improve their sleep. Prebiotics is most important to feed the good bacteria so that they can multiply and they can absorb most of the urea and toxins. We see mitochondria very depleted, and the energy, which is the powerhouse of the cell. So the reason behind this is in kidney case, so L-carnitine is one of the amino acid which is produced by the kidney, and if someone having a low kidney functions, the body have a low L-carnitine. So, and then the mitochondria cannot function properly. So in that case, we need to amplify and support mitochondria, and some other supplements we use. So we'll be discussing more in detail in the next slides. So what diet works best in kidney disease? There is, high level wise, yeah, we want to be low glycemic alkaline diet. A lot of kidney patients have a lot of acidic in like body, metabolic, they are like more acidosis. But plant-based is what we have seen more working with low protein. But again, the diet has to be customized for that particular patients. It cannot be like one generalized diet, but overall anti-inflammatory, low glycemic food, low carbohydrate, a plant-based diet. And then you have to see if there is a potassium is high or the phosphorus is high. So how we are balancing throughout the week, like daily, instead of restricting daily, you can spread out over the week and months so that they are getting the variety of like fiber through the plants, and they are not having deficiencies in terms of nutrition. So I'm not going to talk more on the diet because this is very, very customized. But we are going to talk about more on the functional medicine supplements. So if you see here, there are a lot of variety of, like probiotics, and they are really, really chosen probiotics for, especially for kidney disease. So the most important is the Renadil. Renadil is having the 3 bacteria, which helps this bacteria actually eats the urea and uremic toxins, and they multiply. And we actually need any probiotic, we need something like 200 to 400 billion of these bacteria in the gut, and it is not possible through this probiotic. So that's the reason, if you see the picture down, we actually send this starter to our clients. We send this starter to the clients, and we ask them to make yogurt, curd, using A2 milk or a coconut milk. So coconut usually we avoid because of too much of potassium and the thing, but your A2 milk usually goes well. It is a long fermentation. It is 36-hour fermentation. So there is no much lactose in the milk. It is totally broken down by the bacteria. We add a prebiotic fiber to this process. So if you see, Renidil is the one which is the mandatory for kidney disease. It really helps to decrease the creatinine level. If you see on the top right side, the glucose control and sugar shift, we use for a patient who is having a kidney disease because of diabetes. So these two things, if we start using as a yogurt, we see because glucose control has an acromentia, which helps to stabilize the HbA1c and the fasting sugar. And sugar shift has again some 5-6 strains, which helps to convert the glucose sugar to the mannitol. So I don't have that much time to go in depth about all this, but these two can definitely normalize the sugar level, the fasting, the PP, and the HbA1c in just in 4 weeks. That's what we have seen in the kidney case. Heart center is especially we use for someone having a hypertension and kidney disease. So heart center also we ask them to make yogurt, and this really helps to boost nitric oxide, and it really helps to maintain the good blood pressure. If you see the simple slumber, we are using this for people having insomnia. This helps for a better deep sleep. The Zen biome and is used for the mental health. They got kidney disease. They're having a lot of depression, and they have a lot of fear because they don't know what's happening next. Megaspore is the spore base, which helps to bind and reduce inflammation. Intensive care has a specific bacteria called Lactobacillus plantarum 299V, and that is actually bind with a lot of heavy metals, and it is really powerful for autoimmune cases. So this all we ask them to make yogurt, and I'm giving an example of how this example of Renidil, like kidney probiotics. So if you see that, so per capsule has 45 billion, but this is not sufficient as per our practices. So we use actually 200, 400 billion through the yogurt approach. These bacteria actually they release in the colon, and they start eating all the nitrogen products and the uremic products, and they will multiply, and they will start reducing the toxins so that kidney can get a chance to breathe. So this is how this process works. And in order to feed them, we use fiber. Someone which is the kidney stage up to 4, the acacia fiber is the one we see is very effective as a dose of 1 gram per kg of the weight. Sunfiber has a parahydrolyzed gorgum, which is very easily soluble, and it can be easily used. Pectin helps to bind with heavy metals. So all these fiber are effective. Again, if someone is already in the stage 5, we limit the fiber because their hydration is quite limited. So it's again, it's custom based on what stage of kidney disease they are. This is about the amino acids. So what happens in kidney disease, the patients, they have a lot of metabolic issues. They are fragile, they are fatigued, they have low anemia, iron is low. And most important, the albumin number goes down. So albumin, if it is going below 4, that is a sign that your kidney is like crying. I mean, so you need to help to improve that albumin number. So so this is a formulation where at least any amino acid you buy, this should have at least this much of combination of this 9 amino acid. It should not be anything lower than this. And then you have to take like at least 5-6 gram, like 1 to 2 scoop, depending upon what is the albumin level. The moment albumin number goes to 4.5, then you can decrease this amino acid demand. The problem with albumin going low is because of leakage of protein and albumin, and protein-rich diet cannot be given because that has a lot of effect on the kidney and on the filtration process. So this is really a miracle to save someone and extend at least 2-3 years if they maintain albumin. And also on dialysis, if they are maintaining albumin for at least 4 and above, they will never have any kind of casualties and any emergencies, and they can live like 15-20 years. They can easily live. without the need of the kidney transplant. So similarly, there's other thing we use like mitochondrial support. This has got L-carnitine, because as I mentioned, kidney doesn't make L-carnitine when they are not functioning well. CoQ10 is very important. So we combine mitofuel with mitochondria, like half scoop, something like that. Mitofuel has a D-ribose, which is again helpful for cardiovascular case. We combine the curcumin phytosome, which is better absorbed. This helps to reduce the ESR. Most of the kidney patients, we see high ESR. And SPM is also helpful for a lot of autoimmunity, and it's like made from omega-3. So omega-3 we cannot give that high. Usually the patient can take, then they usually give 3 to 4 grams per day. But patient, if they cannot take omega-3 because of the nausea or vomiting, then SPM is a quite miracle because this is a more active form of omega-3, and its low dose can be effective in maintaining the cholesterol panel and also reducing the inflammation like CRP, ESR. Similarly, these are the other things we usually use in a combination. Depends on what stage they are and what they require. Is all custom, not anything like everything not to be given to everyone. So multivitamin we tend to have with low vitamin A, but vitamin B combinations are important for boosting their hemoglobin, and also it helps for the iron absorption. Zinc is, as you know, the zinc will be always low because the diet doesn't have enough zinc. Vitamin E can help to reduce the ESR. Vitamin C we choose not absorbic form, not buffered form, not liposomal, but we choose a ester form, which makes the body more alkaline. So something with vitamin C ester form with bioflavonoids. Bioflavonoids really helps to nerve health, and also for someone having on dialysis, it helps for the fistula to maintain that integrity. Omega, as I mentioned, we need a high EPA number to reduce inflammation. So there are a few products like Metagenics. They make really good quality omega-3. Sodium bicarbonate is required if the bicarbonate level in the blood report is low. They need to increase the alkalinity. So it depends like how much they need, but this can be really a savior and is a very simply available, easily available, the sodium bicarbonate. Probiotic loading that I mentioned. Like we want like more quantity of bacteria, so 200-300 billion. So yogurt approach. So as I mentioned, some of these strains like Acidophilus longum, Lactobacillus plantarum, Lactobacillus rotari, and iron, carnitine, CoQ, and any antioxidants. All these are really helpful to support mitochondria and maintain reduce the inflammation. Kidney cases, everybody has like low iron, so we need to support, and also the hemoglobin need to be maintained at least around 11, 12, something like that. D3 we need a little bit low amount because most of the kidney patients, they can have osteoporosis and other bone disorders. Some small amount of D3 and their body is not making D3. Sometimes we give them a calcitriol as a active form of D3 because kidney is not converting into active form. K2 is small dose is helpful again to reduce inflammation, and also the arterial issues like arterial calcification, it can reduce. Niacinamide, if someone having a high phosphorus in the blood, it's a very good phosphorus binder. So we use that specific for those clients. So yeah, thank you everyone. So I can take any questions you have.
Thank you so much, sir, for putting out your insights on the kidney dysfunctions and how functional medicine can be helpful in the same. There are certain questions though, if you can answer.
Yeah.
One question is, what would you recommend for someone whose eGFR is 60 and serum creatinine is still high? So do we recommend these products?
So creatinine is how much? Like below 2 or above 2?
Yeah, it's just written still high. So I assume
Slightly high.
they're asking about, more than 1.
So they can at least start with, the gut bacteria stuff. And if they have any other underlying issues like diabetes, hypertension, or autoimmunity, they should address that first with a specific yogurt. Adding an amino acid is not going to harm anything. They have to check the albumin level, and other things they have to optimize. And conventional and functional range are different. they need to optimize the iron level, D3 and magnesium and things like that.
There's one more question in terms of the supplements that you mentioned. Can people without kidney disorders also take Ranidil?
Yes, because this bacteria, so longum is one which is effective for someone having, it actually gives a emotional support, like it's like someone having a mood disorder, anxiety. So Bifidum longum is one of the crucial bifidobacterium bacteria. Acidophilus is useful for respiratory issues. And anyway, it can reduce uric acid and anything which is abnormal. So taking probiotics, someone if not having dysbiosis, like dysbiosis, we have to be careful to start slow and see they may get die of reaction in the beginning. So those cases they have to go slow, but there's no harm in taking Renadin.
Yeah. One more question. Can glucose control be taken by a diabetic who does not have any kidney issues?
Yes, so whatever I mentioned, we use for this thing for specific to diabetes, and the heart center, which I mentioned, is for the people having, the hypertension and stuff. They can easily reverse, and they no need of too much of, other supplements. I mean, there are something we use sometimes like berberine chromium, but, if pendulum and glucose, sugar shift, these two things, if they start taking, they can see result in every 4 weeks. They can at least see 30-40% reduction in the sugar level. But they have to also maintain the diet. It's not like they can eat whatever they want. So if they are maintaining low glycemic, and if they're trying to add, they can experiment and they will definitely see improvement and reduction.
Okay. There's one more question. Someone with kidney failure, with these treatments, can they reverse or stabilize the condition?
So kidney failure means like what is the creatinine level, like 7, 8, or they are already on dialysis?
That's not been mentioned. So I guess it's a general question.
Okay, so suppose it is the end of kidney disease, like stage 5, and they are already the person on dialysis. So what dialysis patient going through, they are struggling, like day-to-day life, like low hemoglobin, anemia, not able to sleep, insomnia, low energy, can't eat at all anything, and there's so much struggle. So all those things can be stabilized. The frequency of dialysis can be reduced from, if they're going 3 times, it can come to 2 times, it can come to 1 times per week. That possibility is there, because this all depends on how much glomerular functions are left, how much the nephrons, they are able to filter things. And if it is autoimmune, then it can be fully reversed if they don't delay too much.
What is the one best biomarker that you would suggest in understanding whether the improvement is happening if you are giving certain kind of a treatment, if the improvement is happening in the current kidney deterioration? Yeah.
Creatinine is one of the simplest marker. Creatinine going down itself gives a lot of relief to the patient, and they know that they are on right path. And other than that, bicarbonate, BUN, urea, these 3 things we check.
Yes. Thank you so much, sir, for your questions. I guess these are the only questions. There's one more question, just one second. Higher creatinine with cardiac conditions, can you give CoQ10?
So any cardiovascular issues, CoQ10 is a kind of, quite good antioxidant. So there's no harm in taking like up to 200 milligram. So yeah, I mean, this should not be any problem.
And any drug interactions that one needs to keep a check on while taking these kind of supplementations?
So whatever the kidney specific and whatever I discussed, diabetes and hypertension, so yogurt and all is safe. Mitochondrial support, everything is safe. Any drugs, I just keep, like, I think omega-3 for someone on statin, we have to be careful not to go very high. Up to 2.5 gram per day is still okay. And then you have to keep a gap from their medications, at least half an hour, 1 hour. Otherwise, the dose, if you start slow and you monitor it, this should be all fine.
Somebody who already has a proteinuria, what would be your dietary recommendation to the person in terms of proteins?
So proteins, plant-based, but then again, they have to check total protein and albumin number. If albumin number is not improving, not going above 4, they must add a good amino complex. There is no other way they can increase that albumin.
By the diet, yes.
And total protein, if goes low, this causes more damage to the kidney.
Okay. Thank you so much, sir, for your session, and thank you for taking out your valuable time in addressing this condition. Thank you so much.
Thank you. Bye, everyone.